Welcome to myTRIAList Trial Talk, Voices of Experience.
I had an initial appointment. He did a biopsy, came back stage 4 prostate cancer.
What was it like to look for a clinical trial?
Reading over different trials. The one that I read was even more generic. It was one of those things, you read it over twice, read it over a third time. And then I had a good friend of mine who's a nurse and she read it. But I wanted to be able to have a consistent team and know that, I want to know going in, what my results would be, or, each day that I do the chemo, they print out, show me, and I take home, obviously, all my levels of where my white blood cells would be, my magnesium, glycerides, everything.
Did your doctor play an active role in helping you find and choose a clinical trial?
He sat me down and we discussed different options. Now, of course, and I wanted, because of the history my brother had, to have the prostate taken out right away. And he said that they couldn't do that because the cancer had spread. So in the course of it spreading, he said that, there was a different couple trials. There was a new trial that was starting and he wanted to know if I was interested in it. He explained it to me, went over pretty thoroughly.
Why did you decide to enroll in a clinical trial?
Deciding to do a trial for me was a no-brainer, because I knew that at least it was going to give them more research material to see how I interact, obviously with the new drugs, how it affects the cancer.
What was the clinical trial enrollment process like?
Had a bunch of blood work done, a bunch of scans done, started my chemo. And my basic goal was he was going to have me do 7 to 10 rounds of chemo with radiation and hormone therapy. And then a new drug that was improved on actually from the past.
Can you tell us about your clinical trial experience?
Doing my chemo every 3 weeks. I do hormone every 2 weeks, radiation. And then at home every day, I'm taking anywhere from 1,200 milligrams of my chemo drug, as well as different various steroids to go along with it. Right now, at the end of the first cycle, I have 2 more chemos and 1 more hormone. At that point, on September 6th, I meet with my surgeon again, and he will then order another PET scan for them to determine how much it's spread throughout my lymph nodes, and if it's actually spread anywhere else besides around the pelvic area by my spine. And at that case, then we have to discuss if surgery's off the table, and I go back in, I start, another round of chemo and then heavy duty radiation.
What was one thing you were surprised to learn about clinical trials that you didn't know?
I didn't know that, going in, the different procedures and and how they're on exact dates. It's very regimented. You can't miss. If you miss an appointment, it's, you start missing a cycle or something. It can it weighs on the trial, so to speak. So you have to make sure you're consistent.
Did you face any barriers when deciding to enroll in the trial?
Being on my feet 10 hours a day, I could no longer do my job to what I expected my capabilities of. And in doing that, obviously puts a big pinch on anybody's pocketbook. I've never been one to file an employment or anything like that. So, I was living off savings, but also the kindness of friends.
How did you find support throughout the clinical trial process?
First responders, amazing people. I can't talk more highly of them, because they treat you right, like a human being. You're not a number to them. When you walk through those doors, you're greeted with a smile, and they ask you, would you like some water? Is there anything I can do for you before your appointment? I want to make you as comfortable as possible. And that's special.
How has cancer care helped you?
My social worker, she had a whole list of financial outreach places, got a hold of people at Cancer Care who were very nice, very responsive, and then provided them the information through my social worker that they needed. That was very valuable and very helpful, for them making a determination, obviously that to be able to financially help me in some way, which was great.
How did your family, friends, and community react when you told them you were enrolling in a clinical trial?
A lot of folks were scared. A lot of folks thought I was crazy to go into a trial, not knowing, what it could do to me. But, that was a choice that I made.
How has the clinical trial impacted your quality of life?
If I wasn't in this trial, I don't know what my quality of life would be, but I've seen it and it wasn't pretty. It was a lot of pain and a lot of suffering. Granted, I do have pain all the time, but not as much suffering. And they've made it tolerable. And they're doing the best that they can do. And with a trial, that's what you have to be optimistic about. That, instead of being maybe 21 months, maybe you can stretch a 5-year stint out, maybe even longer.
What questions would you tell someone that is considering a clinical trial to ask their doctor?
I'd say the most important is how successful have some of their trials been? How successful do they feel that maybe this drug will be, and how it will work, how it will interact, and what it's going to do to their body, how my mood swings are going to be. The overall mental health is very important to ask. And any questions that you do ask, please, your first appointment with your oncologist, don't be afraid, because no question, is too stupid or too ridiculous to them. Ask it. Don't be an introvert, and don't kind of go, okay, I'm going to go in this trial. You need to ask questions. And in doing that, they will ask you questions in turn, and you can let them know, as you're in the trial, how you're feeling, what it's doing to your skin, what it's doing to you mentally, physically.
How did you take care of your mental health throughout the clinical trial process?
I listen to a lot of music, do a little bit of art therapy just to get my attention, because I'm one of these over-attentive and over-imaginative Gemini, so to speak, that I overthink things. And so I wanted to keep my imagination going in a good direction.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
You gotta be willing to step up and not be an introvert and come out of your comfort zone. You gotta ask questions. If you're on the fence, obviously do your research, do your pros and cons, but wholeheartedly think of yourself helping a fellow human being. That if this works, it's going to be great for you, and it's going to be something that they can pass on and help other people.